Hello.
Good. Hello, how are you?
Good morning. Thank you both for joining us. We'll get right to the questions. Dr. Sylvester, what are some concerns for this upcoming flu season and why?
Well, I'll tell you, I've got a couple concerns, but my biggest concern is that our flu season is just about to begin, and I'm worried that it's going to be very similar to what we've experienced in the Southern Hemisphere. You know, if we talk about Australia, it's important to remember that they actually had an early and severe flu season. And guess what? The high rate of influenza struck children 16 and under. So my concern is that if we're not going to go out and get vaccinated, we're going to have a similar flu season here in the Northern Hemisphere and a bad flu season here in the United States.
Dr. Doggett, it appears, though, from the answers Dr. Sylvester just gave, it's important to get vaccinated against influenza more than ever.
It is. We're concerned that what's happening in the Southern Hemisphere may be a predictor for what's going to happen here. We've seen that in the past. But it's also important because we've been getting away from a lot of those mitigation strategies from COVID. So, as the pandemic's kind of winding down, we hope it continues to wind down. We've been stopping some of those measures such as social distancing and wearing masks. Those things protected us not just from COVID, but also from flu. And as we're doing those less and less, we're potentially at increased risk of exposing ourselves to influenza.
Dr. Sylvester, what are key lessons from recent flu seasons?
Well, I think that some of the key lessons are what Dr. Doggett just said. There were mitigation skills and practices that we could all use, but we have a tendency to forget those. The number one way, the best way we can prevent influenza is an annual influenza vaccine. And that's why we're here today on behalf of CSL Seqirus to talk about the importance of an annual influenza shot.
And Dr. Doggett, we've heard it many times before, but if you can reinforce why some people are more at risk for flu than others and what groups those are?
Absolutely. So we know that anyone can get the flu, but people are at higher risk of complications from flu if they're over 65 and also if they're younger. So if they're particularly five and younger, those kids are at higher risk of complications. We also know that people who have certain medical conditions like diabetes, asthma, heart and lung problems are at higher risk of complications. Now is the best time to get the flu shot, and everyone in their household should get vaccinated as well.
Dr. Sylvester, where can the audience go to learn more?
Yes, well, I would recommend that they go to flu.com and that they go and see their healthcare professional. That's the trusted primary care physician. You'll get good information from both.
Thank you both so much. Appreciate it.
Thank you.
Thank you.